The next case, let's see what it is. A child of 18 months was brought to the hospital with complaints of diarrhea, weakness, yellowish discoloration of eyes and skin, vomiting, convulsions, and delayed milestones. On examination, he was found to have bilateral cataract, hepatomegaly, and jaundice. Investigation showed RBS 50 mg per deciliter, serum bilirubin 10 mg per deciliter, unconjugated bilirubin was 8.2, whereas conjugated was 1.8 mg per deciliter. Urine Benedict's test was found to be positive. So now looking at the presentation, what is it? It is discoloration of eyes and skin, shows that the child has jaundice. There is delayed milestones. The child is of 18 months old. RBS is decreased, showing hypoglycemia. Then bilirubin levels are increased, showing jaundice. Urine Benedict's test is positive, indicating that there is a reducing carbohydrate or reducing sugar which is present or which is excreted out in the urine in this particular case. So there is bilateral cataract, hepatomegaly, and jaundice. Bilateral cataract in a case in a child is typical characteristic feature of the case of galactosemia. Now, what exactly is the galactosemia? It is a disorder related to defective galactose metabolism. What is it? It's a rare congenital disorder which is autosomal recessive and usually seen in the infants. The incidence of galactosemia is 1 in 35,000 live births. What is a defect in a case of galactosemia? It is mainly due to the deficiency of the enzyme galactose 1-phosphate uridyl transferase. Now, what is the role of this galactose 1-phosphate uridyl transferase? Normally, the galactose is converted to glucose in liver by the enzyme galactose 1-phosphate uridyl transferase. Absence of this enzyme results in accumulation of galactose 1-phosphate in liver, affecting its normal function and further leading to hepatomegaly, and also affects the various other organs and damaging them. So excretion of galactose due to accumulation of galactose gives the positive test with Benedict's reagent, which is seen in this case. So now coming to the biochemical manifestations or the clinical manifestations. How does a patient with galactosemia present? Now here the patient presents with severe mental retardation. There will be congenital bilateral cataract. Why is this seen? So the galactose which is accumulated due to the deficiency of the enzyme is further reduced to dulcitol. Now this dulcitol accumulates in the lens, resulting in cataract due to its osmotic effect. It's a typical presentation in both the eyes, which is called the bilateral congenital cataract and is a very characteristic feature of galactosemia. Now the galactose and galactose 1-phosphate get accumulated in the liver, leading to hepatomegaly, leading to damage of the liver tissue, hence ends up with the increased bilirubin level, that is mainly the unconjugated bilirubin. That is because bilirubin uptake is less and bilirubin conjugation is reduced, hence ending up with increased unconjugated bilirubin level in galactosemia. The galactose 1-phosphate may also get deposited in the renal tubules, producing renal damage, which further leads to generalized amino aciduria. Hypoglycemia also can be seen in a case of galactosemia. That is because due to the block in the enzyme, that is deficiency of galactose 1-phosphate uridyl transferase, what happens is this in turn inhibits this accumulation of galactose 1-phosphate. This in turn inhibits the galactokinase and the enzyme glycogen phosphorylase, ending up with hypoglycemia in galactosemia. Now, because of the accumulation of galactose, excess of galactose causes increased amount of galactose in the blood. Now this partly is excreted out in the urine, leading to galactosuria. So these are the biochemical manifestations or the presenting manifestations of a case of galactosemia. How do you manage the case? Coming to the diagnosis part, clinical manifestation including congenital cataract and presence of galactose in urine as well as elevated blood galactose levels will help in the diagnosis. This amniocentesis can be useful in prenatal diagnosis. Heterozygous parents could be detected by elevated galactose level in blood after a galactose load test. Coming to the treatment part, if lactose is withdrawn from the diet, most of the symptoms recede. But mental retardation, once established, will never revert back. Hence, early detection is most important. For the affected infant, lactose-free diet is given. Such special diets may be withdrawn after the age of 4 years when the enzyme galactose 1-phosphate pyrophosphorylase becomes active. So this is about the management of a case of galactosemia. So typical presentation of a case of galactosemia is the congenital bilateral cataract, which helps in the diagnosis of the galactosemia.